Hi, my name is Jessica Barnett, and my intended career path is physical therapy. Physical therapists' main goals are to help injured or ill people of all ages improve their movements and decrease their pain. PTs focus on helping their patients with skills in muscular strength, motions, flexibility, and restoring and maintaining physical function. They help their patients improve through a three-step process, and this is evaluation, diagnosis, and rehabilitation. Rehabilitation techniques include different types of movements and stretches, equipment, and hands-on therapy and exercises. Physical therapists typically work alone with their patients. However, PTs do interact with healthcare providers on a daily basis to ensure that the goals and plans of care for their patients are met. Depending on different work settings, which we'll get into later, PTs can work and interact with physicians or nurses, and this can be seen in rehabs, nursing home, hospitals, or any other care facilities. Physical therapists typically start their day with examining their patients. This is to see what they will be treating them for later. They do this by testing their muscular strength, their functions, flexibility, range of motion, balance, coordination, and how they perform daily functions. After this examination, then they can diagnose their patient, determine off the examination performed, and this will help them later in their rehabilitation process. So once they diagnose their patient, they create a plan with goals for how they're going to help their patient. They can do this by creating different interventions, such as exercises, types of therapy, and motor tasks. They can do this by using crutches, wheelchairs, or prosthetics. They also want to teach their patients during rehabilitation on ways to move and perform and do certain tasks without preventing further injuries and to overall help themselves improve. Physical therapists normally work in indoor settings. This can be offices, hospitals, or clinics, home health care, schools, nursing, residential care facilities, or rehabilitation centers, or any other type of care units. The beginning education requirements of a physical therapist is a 4-year bachelor degree. This includes the basic core classes of anatomy, physiology, biology, chemistry, and physics, along with statistics. In the completion of their 4 years, to get into a PT school, they need around a 3.5 GPA. In the mix of finishing their bachelor's degree, a potential PT student should take the Graduate Record Examination, GRE. This will determine verbal reasoning, quantitative reasoning, and analytic writing, and this is what they submit to their PT schools to test their scores. After the completion of their bachelor's degree and their GRE exam, a PT student applies to the PT program, and this typically takes 3 years to complete. After their 3 years, the PT may continue and receive their doctorate in physical therapy, a DPT, and or receive special training in a specific area of care. Depending on which state the PT is practicing in, a license is usually required, and it must pass a state-administered National Physical Therapy exam. When it comes to clinical hours and volunteering, 30 clinical hours are usually required during a person's time in PT school. This will get a student to supervise and experience the workspace of a PT. Activities such as volunteering or internships can get a person ahead in the PT field, and many programs do require that a certain number of volunteer hours are met. Every 2 years, a physical therapist license must be renewed. The expiration date of the license is usually the last day of the person who holds the license birth month. The renewal notice is usually given 90 days before the expiration date, therefore the person is notified, and it is illegal to practice with an expired license. There are many supporting organizations of the physical therapy career. The Foundation of Physical Therapy is basically a non-profit organization that funds physical therapy research and they want to revolutionize how physical therapy is administered in the next generations. The American Board of Physical Therapy Residency and Fellowship Education is a post-professional program that ensures high-quality care and standards, so they oversee specialties and certifications and make sure that expertise in development, education, and evaluation are continued. So there are also many professional journals in physical therapy, such as the Journal of Orthopedic and Sports Physical Therapy. So they publish scientific and relevant content for physical therapists and others in the healthcare community. And basically it provides guidelines and different articles for updating stuff in the physical therapy realm. And also the PubMed journals, they contain biomedical literature from Medline, life science journals, and online books. So in my timeline, basically this semester I'm finishing classes related towards my career as a PT, and I will continue taking these courses in the next few semesters, and soon I'll apply and begin volunteering at a local hospital. In my junior year, which will be 2019, I'll start studying for my GRE, and then later in the semester, I'll establish a list of possible PT schools. As I narrow down my list, I'll do research activities and get myself involved in the community and establish contacts. And I'll take my GRE at the end of my junior year in the year 2020. In the beginning of my senior year, I'll begin and submit my applications and attend interviews that I receive, and by spring, I will make a final decision on which school I will attend, and later graduate with a bachelor degree in health sciences. In that next fall, I will begin the chosen PT school and continue volunteering and getting involved, and I will soon plan to receive an internship and continue my PT courses. And at the end of my education in PT school, I will look for possible places to work.